I'm Kathy Turner, and I'm here to share a story that is more important than almost anything you're seeing on the news these days. This story is important because it affects our children, their health for life. Children in every community with conscientious parents, educators, and doctors. The picture will connect dots that will just make sense and creates a clearer picture of your child's health, and you'll never forget learning about this. I could title the chapters so you would have a roadmap of where we're going, but for this abbreviated presentation, let's just navigate the shortest distance between these dots. I will connect in telling you this story, and it's an enormous story. As you hear the details, please also hear the ticking of the clock, because this message is one of some urgency, tied to your child's growth and development, and our chances of fixing the problem you're now learning about.
The United States is very slow in accepting early treatment. As a matter
They
of fact,
call it the silent crisis. When I learned about this, I wanted to know more because the problems were affecting my grandchildren. So I jumped in. Over the last year, I've traveled all across the country and beyond, learning and even documenting lectures that help to educate and train doctors to first identify the problem. I'm not a doctor, but I can tell this story, and once I'm done, you will be armed and capable of helping your children to become the best versions of themselves. There is a problem, and it has a name. It is sleep-disordered breathing. Knowing there is a problem is just one of a dozen problems that will continue if it's not corrected in time. Click, click, click. First problem, lack of knowledge. Even though 9 out of 10 children are affected, most parents have never heard of this, and most professional health providers are unaware. Even though much has been learned in treating over 3 million children around the world, to describe sleep-disordered breathing in children just gives us a clinical baseline of what's happening. It's the unhealthy way a child breathes while they're sleeping. Typically, the child sleeps with their mouth open and their tongue in the wrong position, and the jaw dropped back to restrict the airway and therefore limit the oxygen entering the body, impeding quality REM sleep from occurring, and further effects. Now that you have the basic picture, let me go on. Problem number 2 is grasping how serious this pattern is, or in many cases, the parents aren't even aware that it's occurring. We can help you recognize these sleep habits as we walk you through a questionnaire, but there's more. The next problem is identifying or recognizing SDB by the symptoms. Let's connect more of the dots that reveal the impact sleep-disordered breathing is having on your child and how it's all connected back to how they're sleeping. The symptoms. I hope to lay out in a logical order to show you how all of this cascades, one problem leading into the next. Clue number 1. We start with the earliest sign to identify, and that's mouth breathing. You will know that the tongue is in the wrong position if your child sleeps with their mouth open. So, tongue position is key.
When the patient lays down on their back, their jaw drops down. This is the airway where the air comes into the lungs, and when they lay down, their jaw drops.
So again, we start with the outward sign of mouth breathing. Snoring. An open mouth may lead to snoring. In fact, it's impossible to snore with your mouth closed.
He's holding. He's holding. He's trying. There he goes. So this has been 3 minutes and 15 seconds, and you can see how many episodes he's had of not getting calm breaths in. Now, watch what happens when I take his jaw and I just bring it forward. If I can. We'll see if I can. And I open his airway. Just bringing his airway forward. Now listen to the quiet breathing. There we go.
It's never a good thing for a child to snore. It's not cute, it's not healthy, and it's leading to other symptoms or signs of SDB. Swollen tonsils or adenoids. With mouth breathing, air that is not filtered and humidified through the nose leaves the tonsils and adenoids to do a job they weren't designed to do. Over time, swelling may lead to the need for surgery. That typically addresses the issue with only temporary improvement. The open mouth breathing will again create the same recurrence in time, leaving your child in an unnatural and compromised state of sleep. Tooth decay. Mouth breathing also creates a dry mouth, and saliva is a natural protection against tooth decay. A dry mouth is an environment for decay, and so often it'll be your dentist that will alert you to another damaging sign of SDB. Over 18% of school-aged children are still wetting the bed. It's a personal matter and only discussed with doctors who generally suggest that they'll grow out of it. That is almost 1 in 5 children, though. Think about your average classroom. Why? Open mouth, tongue drop back to restrict the airway, means reduced oxygen, carbon dioxide buildup, and that throws off the balance of over 600 hormones in the body. This restricted airway takes in less oxygen, which alters the body's chemistry with collective impact. And as a result, having nothing to do with physical control or personal responsibility, the bladder releases and the bedwetting occurs. It's a domino effect. Follow the line of reason and track that cause right back to SDB and sleeping with the mouth open. Restless sleep is sleep with little rest or restoration. We all understand the cumulative effects of having no sleep. It's painful, and a child can't stand back to recognize why they're struggling through life, carrying this weight. Children with SDB may be so deprived that without reaching the various and important restorative stages of sleep, even though they are asleep, they're not producing growth hormones and clearing the brain of toxins that lead to healthy function in the body and brain. Delayed or arrested growth. The lack of REM sleep may be so pronounced that the child's growth is impeded in crucial phases and without correction could have lifelong impact. Chronic allergies, eczema, asthma, it's an internal mechanism that may trigger these outward signs of a problem. If correcting the SDB condition alleviates the allergies and thereby reveals the actual cause, you may have conquered multiple challenges. Before treating with medication, obstructed sleep is another area to rule out when tackling these chronic conditions. Nightmares. Nightmares may occur in a phase of delta sleep that may be reached while REM is not achieved.
When they have mostly delta sleep, which is that deep sleep, slow wave sleep, they're going to have nightmares. And if a child wakes up screaming, that's a very good symptom that they have airway problems. REM sleep is important. It requires oxygen. Delta sleep does not require oxygen. But the delta sleep, the deep sleep that you have tantrum, well, you have nightmares in, that's a sign that they have delta sleep mostly.
Irritability, anger, depression, and headaches. Where does one begin or end in that cycle of exhaustion? It's heartbreaking to think of this weight on any child who's somewhat defenseless in coping with life in this depleted state. So many children and their families have seen the true personality surface when SDB is corrected. Yes, a child in struggle is a family in struggle, and for that reason, we might be fair in saying we treat the problem that impacts the family with stress and fatigue, as well as the child. ADD and ADHD. Again, connecting the dots. Studies show sleep-deprived children mixed with a group of those diagnosed with ADD, ADHD produced such similar appearances and behaviors that medical professionals could not distinguish which category these children fell into. The message to parents may be to rule out the chance of SDB before treating medically for ADD and ADHD. More information can only help you make good decisions and take an active role in their treatment. Academics. Lack of sleep leads to drop in performance, both physically and mentally. The area of the brain that uniquely deals with the function of spelling, math, and science has been linked to this sleep deprivation. How daunting it must be to run with a pack and do it running on empty. Grades and report cards often soar after a child is finally rested and fully awake. Teeth grinding and bruxing. This is one of the top 5 signs of SDB. It's often viewed as a child's natural function when attempting to find breath, to position the mouth and jaw to open the airway. Again, opening the airway may bring an end to grinding and preserves the health of the teeth. Crowded, crooked teeth, malocclusions of many descriptions. The children with SDB have several contributing habits that result in an undersized and weakly formed jaw. Without intervention, a child is typically put on hold until they reach the traditional age of 12 and then sent into orthodontics with limited options, including the extractions of otherwise healthy teeth, bands and brackets with a 90% reoccurrence of the conditions leading to relapse. If you're like me, you may be asking, why is this happening? Well, let me paint with a very broad brush because there are always variables unique to every situation. But our well-intended advances in child rearing has contributed to varying degrees of changes in our children's growth and now to the quality of their lives. No other animal on our planet has ever reinvented the wheel, so to speak, to change the way newborn and young children are fed. Our industrialized world has produced very high-quality baby formula and introduced soft foods into their diet. And that has changed the development of the oral cavity of the mouth. The development of the jaw is naturally to grow forward, down, and expand to accommodate the larger adult teeth when they come in. Breastfeeding is the mechanical exercise that develops the jaw. Also, the use of pacifiers and nipple bottles has altered the function from breast suckling to tongue thrusting to scoop formula and milk from a bottle. The mechanical dynamics have created a higher pitched upper arch and smaller receded mandible.
The first time that child walks in your office, I want you to be looking at that profile, the face, the proportions of the face, and that's your initial impressions.
So now what? Big teeth on the way and no room. Where will we get the room for the new teeth? You're asking the question I asked along the way. Why is that clock ticking? What's with the urgency? Well, let's talk about the parent's dilemma. Let's look at the traditional options on the table at this point for parents to sort through. Not just for the teeth on the way, but all the other just listed symptoms of SDB. Now, let me check in with you right about now. Is it beginning to truly look like the silent epidemic I mentioned off the top? So parents may be told things like they'll outgrow the problems and they'll self-correct. But the odds are overwhelmingly against that. And there's danger in waiting to see if that is the case. Once that time has passed and the growth phase has ended, it's too late to nurture the growth. It's ended, and the condition is more permanently locked into place. that may limit you to the orthodontics to make room for the larger adult teeth and to straighten what is crowded as they're pushing and shoving their way forward. Maybe expanders to compensate for the lack of space. Other considerations will include psychotropic drugs, prescription medications, psychiatric testing, counseling, therapy, surgery, sleep studies, allergy testing, special education and tutoring, sleep aids, changing their diet, rapid palatal expanders. As I was reading off that list, I was feeling the pain and weight of that on families that are struggling to find answers. This could be a child who could go from great to even better, or it could be a child that is in a desperate situation with parents who are overwhelmed and scared for their child. One thing that this list has in common is that they are all Band-Aids, aimed only at the symptoms and not the underlying cause. No permanent solution on the list. They're costly, may have side effects, they're short-term, painful, time-consuming, and ineffective. For children everywhere, I say this isn't fair. Let's fix it. Finally, what's so alarming is the window of opportunity closes as the child reaches puberty and 98% of their growth has ended. Does that grab your attention? How old are your children? Let me paint a couple pictures to help you gain respect for the facts of life. If a child has scoliosis, they put them in a back brace to keep them straight as they're growing. They don't ask the child to grow into a problem and then try to undo the damage. They try correcting the growth through the growth. We're doing the same thing. The teeth can be guided into position through the transition from baby to adult using the natural eruptive forces. Let the teeth come down the chute in perfect alignment as they anchor in for a lifetime using these devices. Wow, that was a mouthful. Anchor in for a lifetime?
In about 1990, I developed an appliance called the Night Guide. And I felt that if we could guide teeth in at, for example, 8 or 9 or 10, why not start before the teeth ever come into the mouth? Why don't we guide every tooth in the mouth as they come in? Fibers would form on these teeth, and then it would stabilize those teeth in a straight position rather than going after it at 12, straightening teeth with collagenous adult fibers. When you let go, they snap right back.
That is the one most intriguing fact I have learned in the last year of my travels and class time with the HealthyStart lecture series. Title this, Collagenous Fibers. It will be a powerful fact that will guide your thoughts about everything happening to your children and their health forever, because it is the click, click, click of growth that, like many other physical laws of nature, you can't turn back time. If this window closes, you may find you are now reduced to that list of Band-Aids and options that I just shared with you. Lean in now and learn a fact of life and one of the biggest changes our body makes as we enter into puberty. Because if we catch a child in their growth years, we can fix a lot of this permanently and comprehensively. A baby has soft bones that build and grow into a solid skeletal structure as we enter adulthood. But beyond that, the newly erupting teeth are going to attach to that jawbone for the permanence of a lifetime. Is it because they fit there with precision and that's it? It's a tight fit? No. If that were the case, how could we shove them around with braces and they're not falling out when we altered that tight and precise fit? Here's what's really going on in their mouth. There are baby teeth that serve us well through childhood. And around them, as seen with high-powered microscopes, there are tiny, nearly invisible fibrils that are starting to develop.
While the teeth are erupting, they have fibrils, or not complete collagenous fibers.
Then they develop and they hook the teeth together, they hook the teeth to the gingival tissue, they hook the teeth to the bone, all the way down to the root end. This is a electron microscopic view of periodontal fibers on bone. On teeth, they're all in one direction. So you can imagine how resistant they are. So we would like to straighten teeth when they're like this.
These minute but growing threads will soon be mighty tether lines that will form a strength bond from the teeth to the jawbone they sit in. And they will form a lock that may be pushed, but only temporarily, before they pull back to their anchored position. How can I paint you a picture? A visual that may help you is fairly simple and a decent illustration. With a lot of hair gel, I can pull off any hairstyle for a while, but then, because the growth pattern of my hair has been set, it will eventually follow the cowlick. I always know the cowlick wins. It will always go back, and the teeth will always eke back into the position they lock down as when the bones and fibers set. So this is why the time to correct the growth pattern of the teeth is when there is still growth to work with.
Females grow about 1.5 years earlier than males. So by the time, some females by 11 years of age are fully mature. There are others that might be 13. If a female is menstruating on a regular basis, they're done. I mean, the game is over. 98.5% of their growth is done. So if you straighten the case before that happens, when there are deciduous second molars still remaining, those teeth are about 2 to 2.5 millimeters larger than the bicuspid coming in. That gives us 4 millimeters of space. 95% of all crowding in the United States is 3 millimeters. So by 4 millimeters, we can correct probably 95% of all crowding.
As you might have caught on or wondered about, the position of the tongue, the mouth breathing, all of those sleep disordered breathing headlines I started out with, what does any of that have to do with these collagenous fibers and the fact that puberty locks down the chance to permanently change the position of the teeth? This is the big connect. In order for real change, in order that these changes we're wanting for your children to become permanent so that they can have a quality of life, good health, REM sleep, and a functioning brain, relationships not threatened with fatigue and constant weariness, we have to fix the problem. Fix the position of the tongue and sleep with your mouth closed for life. If not, a child with these snoring and mouth breathing habits will grow into adults who would today give anything to sleep well every night. It eludes them, it hurts, it limits, it deprives.
I'm 50 years old. I was diagnosed at age 35 with severe sleep apnea. I did one sleep study where I was in the sleep study for 5 hours and I woke up, according to those stats, 300 times. So I don't get a lot of rest. I used to have bottomless pit kind of energy, go all day, all night, sleep 2 or 3 hours and be fine. But since the last 15 years, I haven't slept at all. The last good night's sleep I had was July 1st, 2000.
You can't just tell someone to sleep with their mouth closed. It's ingrained in voluntary habits. And the only way to fix it for them for life and comprehensively address all the issues we talked about, including straight teeth, no braces, and become a nasal breather, is with the device that has treated children in 37 now countries and for many decades. The tongue has no choice but to sit in the right position when wearing this device, and like the exercise of 700 squats a day to produce great functioning legs, 700 plus proper swallows a day will train the tongue muscle in young children for life to involuntarily swallow properly and keep the tongue at the roof of the mouth so the mouth is closed for nasal breathing as nature intended. Beautiful. And the natural way parents want doctors to treat their children. Parents appreciate that this treatment lines up with their best judgment. in being non-pharmaceutical, pain-free, and permanent at a much lower cost. The HealthyStart appliances simply help a child redirect the position of the tongue and bring the jaws together and the tongue forward and away from the airway, opening it for the oxygen flowing. Because the teeth are funneling into position as the appliance guide them, it means straight teeth and healthy sleep habits. It's so clear to connect. It's such a clear concept that parents and grandparents like me know that the FDA has approved it, the materials are antimicrobial, and so is the case. It has the Health Canada certification and is medical grade. So it has the same level of medical clearance as a pacemaker or something implanted into the body. It's soft and it's easy like a pillow for the teeth.
Give me 5, you're like a pro.
See how simple that was? Do you know how many kids have been using this? About 3 million kids.
And because of the repetitive workout in just wearing it, habits like a tongue in the wrong position can be corrected very quickly. Click, click, click. But if you wait until your child is beyond the puberty stage, you can't change the formed jaw. And teeth can be moved, but there is now the chance for relapse because the collagenous fibers, like my colic, will pull the teeth back into the permanent and locked position. Who can help you provide this service for your child?
That's the reason we're here. And
who is watching out for children with these problems? Dr. Earl Bergerson has spent 50 years of his life inventing and developing these life-changing appliances. In his industry, he's a giant. He's developed more U.S. and international patents than anyone since Thomas Edison. He is, in short, a brilliant world changer. DDS, MSD, ABO, 37 years in Illinois in a specialty orthodontic private practice, lectured over 500 times internationally and domestically, taught at Northwestern Dental School.
Dr. Bergerson lectured many times. We're increasing growth in the mandible and actually decreasing growth in the maxilla.
He trains medical doctors, ENTs, pediatricians, dentists, and orthodontists to identify these problems with sleep-disordered breathing and address them early for a permanent and comprehensive result. In traveling with him over the past year, my personal impression is to be in the presence of a single focus. He's academic, committed to the diagnosis of every case submitted, and has an enormous database of case studies. The results to be converted to a precise and digital application for the benefit of future cases and for many years to come. For you, the parent, the time it takes to make these corrections is a fraction of the time an orthodontic treatment would last.
But he had corrected 5 millimeters of his overbite. That would have taken me 2.5 years in his case to do.
And it will correct all of these other issues as well as straightening of the teeth.
passionate because we're seeing them at an age where we can help improve their lives forever.
When we start early and there is compliance, there is not a relapse issue and the ongoing expense of future care. Dr. Bergerson is the inventor. There is no other appliance of equal quality or that simultaneously addresses hundreds of aspects of oral development, that holds the certifications, 511 current patents, FDA approval, and made of these safe and unique materials. Parents know that dentists may be the first to spot problems long before there are outward signs of illness in patients of all ages. And that's true of our children as well. They see the results of open mouth breathing and tongue position. They can be certified to offer HealthyStart and see your children younger and with more frequency than other doctors. They have the equipment that provides the medical workup and models to diagnose and create treatment plans, and the protocol and the staff to support the ongoing care. In short, certified HealthyStart doctors, orthodontists, and dentists possess the right tools and are trained to provide this care. The sleep questionnaire is a critical first step, and we encourage you to diligently watch your child sleep before you're trusting your presumptions to answer the questions that give doctors a baseline and guide that first evaluation. The science is irrefutable. with numerous studies and peer-reviewed journal publications. Your next step? The sleep questionnaire. And call our office, 1-844-KID-HEALTHY.